So it's not easy to get the right answer, but if you got it, it's right. It's correct, right? It's complex, but the answer's simple. If I give
So
you
how do you test the validity of using this
well,
talk therapy?
well, that is a very good question, and it depends on the person and the situation. We have so if someone is in need of caregiving, then
Yes,
you must use the questionnaires of the caregiver. So
I see.
that's what we do. So in
Okay,
dementia or the autistic kids or caregiver sense, we ask how do they see the client doing, and we ask how are you doing, right? So we get
okay,
that feedback. When we deal with like quote unquote like normal, goofy people or brain damaged people, we use biodata to track them. That's the first thing. So if somebody comes to me and is like, I don't have anything wrong with me. I'm like, oh, that's good. And I said, well, yeah, you're on the call, so I don't have anything wrong with me. And I said, well, how's your sleep? Sleep's great. I said, well, how do you know? You're unconscious for 8 hours a night. How can you tell me your sleep is great? Well, yeah, I do get a little sleepy at night, and blah blah. They go on this list. So if we don't, and sometimes we need to do this with the caregivers and the patients too. We track their sleep. We track their heart rate variability. We track their activity levels. And then we get a measure of the things that we want to improve. If your sleep does not improve, your brain will not improve. So I'm going to track your sleep. And as we talk about in the book, the heart rate variability is sort of important. It's the lower your heart rate variability is, your increased risk of death from anything it goes up. So if I make that go up, I made your health go up or things
yeah.
like that. So that's how we do it. And we have a new app. I don't want to take up too much time, but we have a new app out now that we measure your brain scores so we can kind of dial right in on how much, light you need to have. So it's an individual thing. That's what we do.
So is that available to anyone that purchases